Well, we're very fortunate to have both Professor Kivipelto and Professor Banerjee to spend a couple of minutes speaking with us today, following your brilliant talks yesterday in our forum at the Canadian Academies of Health Sciences. So I'd like to start off with Dr. Banerjee and ask, what are the challenges that we face regarding dementia?
Well, for me, there is no bigger challenge for health and social care systems, for families and for countries than dementia. It is the great challenge of the 21st century. The numbers with dementia are remarkable already. There are already 47 million people worldwide with dementia, which is, for example, more than the number of people with HIV/AIDS. And those numbers will triple in the next 25 years. We know that dementia is a costly illness, costing $600 billion per year. So if dementia were a country, it would be the 18th largest economy in the world. If it were a company, it would be the largest company by turnover in the world. This is a massive issue, both in health terms, because of the profound negative impacts that dementia has on the people with dementia themselves, on their families, but also on services and also on the economy of countries because of those profound negative health impacts, but also because of the wealth impacts on countries as well.
We understand that dementia is a huge problem at this time for the reasons you just stated. Is there any way to prevent dementia?
We have very exciting news about prevention. It's actually not so long time ago, high age and genes were the only established risk factors for dementia, leaving very little space for prevention. But now we have evidence from longitudinal studies linking several modifiable risk and protective factors to dementia. What has been missing so far is the evidence for randomized trials. And now we have been reporting the FINGER trial that is one of the first multi-domain intervention trials aiming to prevent cognitive impairment. And in this study, we could see very clearly that this multi-domain lifestyle intervention with physical activity, dietary counseling, cognitive social stimulation, and management of all vascular risk factors could really stimulate the cognition so that the intervention group did much better already after 2 years. And I think this is really the evidence we have now. Of course, we need to study much more, but we can also start implementing the results. And I think because dementia shares many risk factors with stroke, cardiovascular diseases, and diabetes, integrated interventions might be the way to go.
So then let me just have you expand on that a little bit for the person, for the individual who may have family members with dementia and who are concerned about developing dementia. What would that individual want to try to do to prevent dementia?
We could summarize by saying that everything that is good for the heart is good to the brain. So taking care of blood pressure, cholesterol, diabetes, all these things is very important. But it's also important physical activity, cognitive activity, and mental activities, social stimulation as well. Healthy balanced diet is good for the brain. So it's all these different components that are important. And what I also want to say is that it's not all, we don't even need to prevent always. If we could only postpone the onset of dementia, that would have a huge impact on the society as we heard previously.
So let's go back to the issue of dementia and society and healthcare provision. Can you talk about how these issues, the taking care of oneself, just as one might, and most people know more about preventing heart disease than they do about dementia. So if we're to follow those kinds of criteria that we follow with heart disease, what kind of an impact might one expect to see? So, and what are the challenges, actually?
So it is absolutely the case that what is good for your heart is good for your head. The amount of dementia that might be prevented by these sorts of approaches is probably about decreasing the numbers of people with dementia by 10, 15, 20%. However, population growth means that the numbers of people with dementia will continue to rise. In the absence of a cure that will make dementia go away, and we're a long way away from delivering that at the moment. In the absence of that, what's really important is for us to remember that there are already a large number of things that we can do that can enable people with dementia to live well with dementia. And the challenge for health systems and societies is to make available to all those people with dementia these good quality interventions as early as possible. So, diagnosing people well and diagnosing them early in the illness when there's a chance to prevent risks and harm happening is tremendously important. And then providing excellent quality care from diagnosis through times at home when they're supported at home, through their transitions into general hospitals, which can often be difficult places for people with dementia, through to care homes at the end of life. There are already a lot of things that we can do to enable people to live well with dementia. The challenge is enabling those to happen in our societies.
And if I may add here, I totally agree, and even here, the lifestyle factors are so important. It's not only to prevent, but we could give the same type of interventions for people who already have dementia.
And that's so important because there's often this concern when you have dementia that because we don't have a magic medicine that will make it go away, that there's nothing you can do. Nothing could be further than the truth than that. There are all the lifestyle things that are good in terms of prevention, are likely to be good in terms of improving your quality of life in dementia. And there are things like education of families, there are things like planning for your future, there are things like being able to interact socially in the ways that you used to be able to. If you can make all of those things happen, then people can live well with dementia, and you can prevent the harms that happen in dementia.
Well, I'd like to thank you both very, very much for taking the time following the presentations yesterday to sit and share some of the points that were raised, that you raised during our meeting yesterday. So thank you very, very much, and have a safe trip home.
Thank you.
Thank you.